hospital roommate didn't know what to do. Here I am, a board-certified internal medicine physician and former health insurance executive, which gave me a complete 360-degree view of the entire American healthcare system and how it works. Or so I thought. Until I became a patient and met my hospital roommate, Mia. Mia is a young mom of two very young children who shared with me that this was actually the second time she had to be admitted to the hospital for the same serious condition, and that she was thinking about leaving the hospital against medical advice. The first time she had to be admitted, on the day her docs were finally saying it was safe for her to be discharged, someone from the hospital's billing department came in and said, "Before you can leave, you have to sign this agreement to pay the balance of whatever your insurance doesn't pay." That's called balance billing, folks, and it's wrong. The point is, I knew Mia had been tricked into signing an agreement to pay a bill she did not owe. Up until now, as a physician and a health insurance case reviewer, I thought our healthcare system was expensive, but honest. I didn't know tricking patients into paying huge amounts of money they don't owe and can't afford was a thing. But it turns out it is a thing. In our current healthcare system, insurance companies and providers are forced to prey upon patients so they can make their profits. And they don't care if Mia or you get conned into a lifetime of debt and a destroyed financial future forever. The hospital gave Mia an impossible choice, literally, her money or her life. What would you do? Would you have signed an agreement to be billed whatever the hospital asked you to pay? That's something to think about because most of us in the United States don't have basic medical financial literacy. And the problem is, without medical financial literacy, we don't have financial stability. Many of us have heard the statistic that medical bills are the #1 cause of debt and bankruptcy in the United States, but most of us don't know why. We're going to talk about why this is in a minute, but first I want to point out what we're talking about really means. If medical bills are the #1 cause of debt and bankruptcy, what's the #1 cause of divorce? Money problems, financial differences, money stress. So there's a direct relationship, a direct connection between medical bills and destroyed families. And if this weren't horrible enough, studies show that those of us who can't pay our medical bills are less likely to follow up for care or take our medications because we're afraid of racking up more debt. So we're more likely to be in poor health, resulting in premature death. All right, so how did we get here? Why are medical bills the #1 cause of debt and bankruptcy? In 2010, the entire American healthcare game completely changed when the Affordable Care Act, or the ACA, became law, which got rid of the need to have no pre-existing conditions in order to get insurance. The problem is for insurance companies on which the entire American healthcare system is run, for them to be able to make money, they had to shift a huge amount of expenses to patients, meaning you. And please understand this. American health insurance is not like car and homeowners insurance because it's not meant to protect us from financial catastrophe in the event of an emergency. They just provide us with access to discounted medical services. That's it. And here we are. There are more than 100 million Mias in the United States. And because health insurance only covers a part of medical care we get, this number is going to keep getting bigger and bigger year after year after year. That's the bad news. The good news is it doesn't have to be this way. There are 3 game-changing plays you can run to win against the most common fouls that insurance companies and providers try to run on you so you can save your financial future from predatory medical billing. Number 1, automatically negotiate every big medical bill without really negotiating. First, whether or not you have insurance, when you get a big bill in the mail, call the provider's billing department to ask for a real bill with CPT codes. CPT codes are to medical services what barcodes are to products in a store. And you need to call and ask for a real bill with CPT codes, because 8 to 9 times out of 10, the first bill patients get are not real bills because they don't have CPT codes. And let me tell you something. Insurance companies would never, you know how they say never, never? They would never pay anything that doesn't have CPT codes. Why should you? Then, once you get a real bill with the CPT codes, do an online search for each CPT code to get a description of the billed medical service and what Medicare pays for the service. Medicare rates are the lowest prices to pay for medical services provided in the United States. Add up what Medicare pays for each CPT code to get the new total for your bill. This is the price you're willing to pay for the services you received. Then call back the provider's billing department to request an interest-free payment plan for your new bill total that fits your budget. And what you've just done is automatically negotiated a medical bill without really negotiating. Number 2, always apply for financial aid for all hospital bills, whether you think you need to or not. Most hospitals in the United States are nonprofits, so they have to give you discounts based on your income in exchange for not paying taxes. But even for-profit hospitals give discounts that are sometimes even more generous than nonprofit hospitals in the exact same area. So whenever you get a big medical bill, whether you have insurance or not, and before you automatically negotiate the bill to the lowest price, call the hospital billing department and ask for a financial aid application to see to what their policy reduces your bill. Always, always ask. And number 3, beware of balance bills. I mentioned balance billing earlier. Balance billing is when an in-network provider sends you a bill for the difference or balance between the provider's full price and what the insurance pays to make you believe you owe that money, that it's a valid bill. It's not. Don't fall for it. So now we know why the old way of paying medical bills is literally dead wrong, and we know what to do about it. After I shared this information with Mia, she stayed and got the care she needed without going further into debt. And just like Mia, if you're ever put into a situation in which you're made to choose between your money or your life, you can choose life and not worry about being in debt forever. We know the American healthcare system needs to be fixed, but until then, we can protect ourselves and our loved ones. We all have the power to do this. You have the power to do this. You got this.